hip pain is usually due to arthritis of the hip. Arthritis of the hip is a condition in which you develop thinning of the cartilage. The ball and socket joint of the hip looks like this, essentially. As that hip starts to wear out, we get thinning of the cartilage that coats the femur or the ball and the socket. Once that cartilage wears out, you start to develop bone spurs and your hip starts to grind and not move quite as well as it did when you were younger and your hip was in better condition and had more cartilage. Once you reach that point and you're having quite a bit of pain, we start talking about hip replacement. So we make an incision like we discussed either in the front or the back of the hip. We get down to the hip joint, then we use a saw to make a cut to remove that ball from the joint. Once we remove the ball from the joint, we use a specialized instrument called a reamer. The reamer goes into the socket and it removes all of that arthritis that you have developed over the years. Once we've removed that arthritis, we place a new metal cup into that socket. That cup is secured with a screw. We then place a piece of plastic called polyethylene, which is a highly engineered plastic that has minimal wear properties. Once we place that, that serves as your new cartilage essentially. We then turn our attention to the thigh bone or the femur. We use specialized instruments called broaches to size the appropriate implant. Once we have the appropriate implant with the new ball, it is implanted into your femur securely. We then reduce the hip, which is to put it back into its socket, and then you're stitched up and you're back on your feet immediately that day after surgery.